Thank you so very much for staying with us this morning right here on Sunrise. It's always our pleasure having you here. And as an expectant mother, the fear of a premature birth is unimaginable. Unfortunately, though, some preterm births result in loss and some healthy and strong babies as well. So Syriah-Rose is here with us this morning, and she is here on set and accompanied by her mom, is that Sashoie Bartley, and also consultant neonatologist at the UWI and founder of the Caring for Miracles Foundation, Dr. Jillian Lewis. Welcome to the show, ladies and
Thank
baby.
you.
Hey, hello.
Hello.
Hey, beautiful. She's
there.
live on TV, looking so beautiful in her purple. So, Doc, you know, talking about preemies, as an expectant mother, there are so many things that we go through, and a lot of people may not understand or even appreciate the psychological stress that a lot of expectant mothers go through. Define what is a premature birth.
Sure. So prematurity refers to delivery of an infant before 37 completed weeks. And there are different categories of prematurity. So very preterm infant is an infant delivered before 28 weeks, moderately preterm between 28 to 32 weeks, and then 32 to 37 weeks late preterm.
Oh, wow. And what are the effects of that? So if a baby doesn't, you know, is not in utero for the 37 weeks, what possibly?
Well, as you can imagine, with a baby being born prior to term, there's underdevelopment of everything. All of the organs are impacted. The complication that they encounter most often, though, is related to their lungs. So because the lungs are underdeveloped, many of them need respiratory support, which can range from just a little bit of oxygen via the nose to being intubated and placed on a ventilator.
Wow.
What does the literature say about how we can predict? If we can understand causes, then how we can possibly predict and spot before time?
So, excellent question. It is something that has befuddled us for years. And despite the advances in medicine and improved survival of preterm infants, we still have difficulty preventing preterm birth. But there are a number of things that can predispose a mother to delivering preterm.
Right.
So issues with mom, for example, elevated blood pressure may require us to take the baby sooner than planned. Multiple gestations, so twin gestations, triplets, quadruplets, etc., tend to be delivered prematurely. And there may be times when there's something wrong with the baby in terms of the baby's genetics or other abnormalities which may require the baby to be delivered preterm. But the truth is, quite often, we are not able to predict the possibility of a preterm delivery.
Is it frequent?
It is. So 1 in 10 babies worldwide are delivered preterm.
Wow.
And in terms of our statistics here in Jamaica, about 30% of our deliveries are preterm.
So talk to us about your organization, your foundation, and what exactly do you do?
So we are a multidisciplinary group of neonatologists, neonatal nurses, former preterm graduates who have come together to improve the quality of care that's delivered to our preterm infants. We do this in a number of ways. We do this through education. We host an annual symposium, and we'll be doing so on the 30th of November, which focuses on issues related to prematurity.
Right.
Additionally, we're currently working with the obstetric and neonatal teams at UHWI to develop and execute a golden hour quality improvement initiative.
Right. What's the golden hour?
The golden hour.
I know what that is, but you know, I did mine, you know. But talk to us about what's the golden hour and why is that important?
So the golden hour refers to the first hour of life after delivery of a preterm infant. And interventions within that period of time have been found to impact the trajectory of the life of the child. And this sort of approach of philosophy is developed from the adult literature, which is found in adult trauma. The interventions, if they're done in a standardized, protocolized, effective, efficient way, can impact the quality of life of the adults. So it's a very similar philosophy.
Yeah. So essentially, after the baby is born, barring any issue, you know, you put them on your chest and you literally hold them. So it's skin-to-skin contact, uninterrupted, for the baby on your chest for an hour, then on daddy's chest for an hour if daddy's there. And it helps with bonding, it helps with growing, it helps with the nervous system. It just, So unless something is wrong and the baby needs to be taken to, you know, the NICU or somewhere, golden hour, I would recommend it for everybody. But let me just get mommy and this beautiful princess involved here now. Good morning to you, mommy. How are you doing?
How are you doing?
I'm fine.
Very well. Talk to us about, you know, this beautiful young lady here. Nobody would have ever thought that she was premature. Talk to us about that journey.
Well, Syriah came at 28 weeks.
28 weeks means what? 7 months?
7 months.
Yes.
She was a pound and a half. She was this small.
Wow.
Yeah. Yeah.
Wow.
And we were in the hospital for about 4 months.
You were in the hospital for 4 months? Oh, wow.
I had severe preeclampsia.
Oh, wow. What was the news like, receiving the news that, you know, the baby,
Have to
it's
take her
27
early.
weeks, it's going
Well,
to happen?
When I was growing up, you hear that the baby, once you reach 7 months, the baby can survive.
Yes.
So I was trying to get to 7 months.
Yes.
Because I was there before. Because my pressure got elevated. It was at 200 over 100 and something for the whole entire period. It wasn't moving.
Wow.
And I was on 3 different blood pressure medication, and it still wasn't.
Still wasn't coming down.
Right, so they wanted to keep her as long inside so her lungs could be developed. So we got the surfactant, it was, for the lungs. But I started having edema and my platelets started to fail.
Wow.
And my kidneys got damaged, so they had to take her.
And that is why I say to people, pregnancy is a
It's not
road.
easy.
It's not easy.
Yeah.
It's a very thin line between life and death, and
Yeah.
so many other things can happen in between. So
Yeah.
when people are encouraging women, oh, get pregnant, get pregnant, get pregnant, they don't talk about the in-between.
Yeah.
And these are the things that a lot of women have to endure in order to bring life into this world.
Yeah.
So
And for
talk to us
them to-
about her recovery now. So you should weigh a pound.
She
and
weighed
look
up
at her now.
a very little. She was very little.
Yeah.
She had a journey. She had quite a journey. She had so her stomach wasn't fully developed. So they thought she had something that they call Hirschsprung disease. That's where the stomach is not fully developed. So where the intestine and the anus would connect, she wasn't able to poop on her own. So we had to intervene with that. She also had ROP, retinopathy of prematurity. So being on oxygen for too long, it damages the eyes.
Yes.
And absent hearing at one point. She had an apnea episode where she stopped breathing. Quite a few experiences.
How are you feeling now in terms of seeing her now, going through all of that? How are you feeling now?
I'm happy. Back then, I was just trying to get through the day. I didn't see this day happening where I'd see her going to school or she's saying, Mommy, you're stressing me out or anything. I was just trying to get through one day at a time.
How old is she?
She's 6.
May I talk to Syriah? You want to talk to Syriah, Uncle Dennis?
Hi, Syriah. How are you?
Hi,
How are you? Good morning.
good morning.
How are you doing, sweetie?
Fine,
How are you feeling?
good,
Good. I see you're dressed in your purple. Is purple your favorite color?
yes,
Oh, lovely.
Oh.
And what games do you love to play?
Roblox,
I know that.
Say Roblox.
And do you love mommy?
yes.
Okay.
Okay.
Okay. All right.
right,
So
hold on.
Syriah did a little dance for us.
Oh, yeah.
Dennis,
All right,
right?
let's have a look.
So
Can we
let's
have a look
see
at it?
dancing Syriah.
Lovely.
I wonder if Syriah-Rose can get Uncle Dennis a run for your money.
But, no, I thought you were going to say you wonder if she can give me some lessons. Because she can dance better than me already. So, I mean, but it doesn't take much to be better than me at that. But, you know, Syriah, what school do you attend?
Langley Potory School.
Which school?
Ligani Prep School.
Oh, Ligani Prep. Okay. And you know what's she like at school? What's she like? Well, she looks like a regular kid.
Yes.
She's in grade 1?
Yeah, she's in grade 1. She swims, she dances, and she's coming out of her shell. She's finding her personality. She's having her besties, and she loves doing her homework, and she loves to play.
I absolutely love this example that, you know, for other moms who have preemies and you're worried right now, you're petrified about, oh God, my baby weigh 1 pound, and so Syriah-Rose is an example of what's possible.
Doc, tell us about the symposium that's coming up and how that can help to maybe give some hope to the moms and dads, who are going through this.
Absolutely. So we tend to focus on everything related to prematurity during the symposium. And this year our focus is on supporting the family's mental health and resilience.
That is it.
And you spoke about the trauma and the challenge of going through pregnancy. We're focusing on the postpartum period, recognizing that that can be a period of toxic stress for families and babies, as well as admission to the NICU. So we're going to be looking at things like postpartum depression. We're going to be addressing trauma-informed care, which is an approach to caring for families and interacting with families that provides for them a soft landing space and provides for them emotional support so that the NICU period and the postpartum period doesn't present to them an additional source of trauma or stress. And what we hope to do is equip attendees with the skills to recognize a family in distress and to provide support.
What I would ask, could you please include a session that focuses on empowering fathers to offer the support that their partners need?
Absolutely.
Because you have man who is not that they don't want to assist, it's not that they don't want to, it's that they feel powerless because they don't know what to do.
Or know how to,
and the first 2 or 3 times when they try to help and it doesn't work, and they may pull within themselves and it causes a corollary of negativity. I'm going to ask that you provide skills and real life assistance, not just preaching, but that's real skills.
So daddy do this, put her hand here, put her foot there, you stay up during this hour. Daddy, you make her some tea, you rub her head, you say these words, you don't use these words, and don't say that. And so real life, and I really like that point, Dennis, because the fathers, the partners play a very integral role. Even when you're getting help from your mother, your auntie, and your friends, there is something
because that is something that women sometimes do. My mother is here, my auntie is here, my sister is here, all right, you can, and then you feel pushed, so you pull back, and you go have a drink with your brethren them, and you cuss about it, and they never hear that side of it.
Yes, absolutely. We will have the parents' perspective, absolutely.
Syriah-Rose, have a beautiful day. We love you, we're rooting for you, and we're supporting you, okay?
Okay.
All right, love you, sweetie.
She's concerned about how her hair looks. She's a girly girl. She's a real...
I said this with all due respect, he was a hot girl. That makes me here right now. But mommy, I want to say congratulations to you as well for being a trooper, for being a champion.
Thank you.
The road is not easy, but you have survived and you've done excellent. And your daughter is a representation of your inner champion. So thank you, and I wish you also all the best.
Thank you.
Thank you so very much. Our wonderful guests this morning, Dr. Jillian Lewis, so well poised, darling, consultant neonatologist at the UWI and the founder of the Caring for Miracles Foundation, Syriah-Rose Bartley, preterm NICU graduate, and trust me, star baby right now. You understand? Star girl, right about now. You understand?
Big
and
dancer.
Sashoie Grant Bartley, the mommy of Syriah-Rose and a beautiful champion herself. After the break, we're going to be talking art ventures. Sunrise continues after this.